Hello everyone, my name is Matthew Walker with Medical Device Academy, and I'm going to discuss when to use a gap analysis instead of an internal audit. The main areas I'm going to discuss are: what does the gap analysis do? What does the internal audit do that the gap analysis does not? And when to use the gap analysis instead of an internal audit. So what does the gap analysis do? The gap analysis or compliance assessment tends to be a document-focused activity. It takes a document and pits that against defined criteria in a line-by-line comparison with a regulation. Now, this is not line by line in the sense that line 1 of your procedure has to be an exact word-for-word copy of line 1 of the regulation. Instead, it's a line-by-line scavenger hunt of the elements that the regulation outlines, then tracing those elements back to where in your documents those requirements are met. Now, when I say document, the document could be a procedure, and in fact, many regulations contain wording along the lines of the manufacturer shall implement and maintain procedures on something or other. It could be corrective action processes, shipping, incoming inspection, something like that. But it's kind of like a Where's Waldo game with your quality management system. And if the regulation says that you must write something in blue ink, then your procedure should require that it is also written in blue ink. And if it doesn't, well, boom, gap identified. Before we can examine our documents for gaps, we need to determine what regulation we're going to be comparing them to. And when I say regulation, much like document is kind of a catch-all term, well, so is regulation, at least for my purposes. By regulation, I mean regulation, standard, laws, codes, just accepted good practice, something that's a regulatory constant that you're going to compare your documents against. And for our purposes today, we're going to pretend our fake regulation, Section 1, states that all records must be hand-signed in blue ink. Some of the examples of gaps we might find within our documents, since the regulation states that all records must be hand-signed in blue ink, if our procedure does not address the color of the ink that we're using at all, that's a potential gap between our document and the regulatory requirements. If our procedure has allowances for electronic signatures in records, that doesn't meet the requirements that all records have to be hand-signed in blue ink. So if our procedure says that we can use black ink for signatures, there's another gap. The regulation clearly states blue ink. You also don't have to clone or just copy and paste what the regulation says. The procedure doesn't need to be a word-for-word copy that says all records must be hand-signed in blue ink. However, it does need to be worded in a manner that every record shall be hand-signed only in blue ink. So what does the gap analysis not do? The regular gap analysis won't examine the records produced by the process outlined in your procedures. At times, a gap analysis could be part of an audit, but what it's missing by itself is the examination of the process as a whole. The regular gap analysis doesn't look at records produced by your process, but what it is good for is textual comparisons of your procedures against the elements outlined in the regulation. The way I like to explain it is that the gap analysis verifies that your documents contain the required elements as outlined within the regulations. The internal audit takes that a step further and validates the processes that those documents are involved in. And it does that through examining records, interviewing employees, observing operations in the processes. But the gap analysis verifies documents. The internal audit validates processes. So when do you use the gap analysis? You use them for new implementations. If a system's not mature enough to produce records yet, then it's kind of hard to determine if the processes are effective. The evidence that would be used to prove that effectiveness just hasn't had a chance to be generated yet. And instead of proving you have an effective process, the audit report's just going to have a lot of notes about how there were no records to review. However, in these early stages of implementation, you can determine if the requirements are at least met within the documents. You can also use a gap analysis for when there's changes being made to the regulations themselves. So if ISO is going to come out with a new version of ISO 13485-2016 and maybe update to 13485-2020, the gap analysis can be used to help identify the areas that need to be updated in your documents to reflect the changes that are made inside the standard. And bonus points if you can do this early enough to make changes to your system before any implementation deadlines. The gap analysis can also be used for exactly the opposite. It could be used for planning changes to your system. So if your quality system's currently only compliant with the QSR, 21 CFR 820, and you decide that you're going to work towards ISO certification for 13485-2016, the gap analysis can help identify the differences between your current practice and what you need for certification. So always bear in mind that the gap analysis is just one of many regulatory tools. It's never going to replace doing an internal audit. And in fact, depending on the type of audit you do, the gap analysis is going to be a large portion of it, especially if you're using something like the element approach to auditing. What the gap analysis does do is help you maintain a living quality management system. I would like to extend a sincere and heartfelt thank you to everyone who stuck with me this long. But as you already know, I like to end my videos with just absolutely egregious self-promotion. And for that, you know that my name is Matthew Walker, and you can reach me at matthew@fdaecopy.com. I'm a medical and technical writer that works for Medical Device Academy, and I work specifically in quality systems and auditing. You can also reach our president, Robert Packard, directly at his email at rob@13485cert.com. Not only is he our president, he is our de facto expert in regulatory submissions, including 510Ks, de novos, and CE marking. If you would like further information on trainings, webinars, speeches, conferences, technical file auditing, internal audits, or more, feel free to reach us on our website at medicaldeviceacademy.com. Thank you.